I'm sure this was as hard for everyone as it was for me, for all of us who are descendants of genocide. This brings a lot for us. I want to share a very brief and family experience. My grandfather was one of the two who survived the genocide. During deportation, they were separated. One ended up in Perchnotz-Puin in Lebanon, the other one in France. Perhaps I was around 5 years old because I have pictures. We are driving to the airport, very excited, everyone is happy. My grandfather at age 45 found his brother in France. As a very young child, I must have been 5 years old that I can remember that there was so much emotions, so much hugging. My grandfather hugged his brother. They looked so much alike. They hugged each other for a long time. And on the way back, there were laughter, there were tears, there were laughter, there were tears. We were all processing so much lost time, and especially my grandfather. And unfortunately, he was only able to be with his brother for 10 days. For whatever reason, they never were able to see each other. The grandchildren were able to see each other. But I'm sure that's, and interestingly enough, my grandfather passed away at the age of 68, and he was known to be very anxious, always anxious. And during the war in Lebanon, he would buy a lot of bread and run from where we lived, about half an hour, go deliver bread. So knowing trauma work, we say the body keeps the score. So his anxiety was all related to the trauma or the unconscious that he has been carrying with him and unresolved. So this is a very good time to transition to my next speaker, who has a very impressive biography, Dr. Shakeh Kaftarian. Just a couple of highlights, the biographies of the speakers, I want to do justice to their amazing, amazing background. I'm just going to share a couple of highlights and my personal, if I know them, or the research I was able to get about them. Dr. Kaftarian is a medical psychologist. She has served in several capacities. She's a research scientist and administrator at the National Institute of Health and the Substance Abuse and Mental Health Administration of the U.S. Department of Health and Human Services. She was invited to serve as a senior advisor at the White House Office of National Drug Control Policy and as a consultant to the UN for a variety of health programs. She served as an adjunct research professor, as well as is the author of several books that are being used at graduate universities. She is one of ours, and she is the spirit behind and the mastermind behind this conference. She had an idea and she brought it out to us and rallied us, and here we are. Dr. Shakeh Kaftarian.